Thank you for the introduction and good morning everybody. So it's a pleasure for me to discuss with you this new technology, Thulium Fiber Laser. Still my disclosure, the same like yesterday, and just keep in mind that I'm a consultant for IPG and for Olympus. As you know, these two companies are actually involved in the development of thulium fiber. So I think we have seen today a fantastic demonstration using the thulium fiber, but I just would like to come back with you regarding this new technology. For you, it's not really a new technology because you know that there are only two countries in the world actually where you can use the thulium fiber. That's Russia and India. For the rest of the world, it's actually not possible to use the thulium fiber because it's not CE and not FDA approved. Regarding laser technology, you know this acronym, L means light, and I think that's the most important part of this name, that when we are using laser technology, we are using light. It's not a shock wave, it's not like ultrasound or pneumatic. We use light, and because of specific light, we are able to break stones. But we should all the time remember that this is light. Just also to remember you probably, these two names, holmium and thulium, maybe you know that it comes from the same person, Mr. Cleve. Mr. Cleve was a Swedish guy. He was a mineralogist. And many years ago, 1879, he was looking for new elements, and he discovered the holmium element and the thulium element. And since he was a Swedish person, he gave the name of holmium for the first one, just because of the name of the Latin word of Stockholm, Holmia, and that's the reason why we are using holmium name actually. And for the thulium, he used the Greek word of Scandinavia. As you know, Scandinavia means the lands from the north, and in Greek it's Thule. So he used this name to name the thulium element. So the two names are coming actually from Sweden. Before we discuss thulium fiber, I would like to come back a little bit with holmium, because you need to understand this holmium technology before we move to the thulium fiber. First, I would like to say that Holmium-YAG, as you know, is the gold standard actually for the upper tract. We can treat any kind of stones. There's no specific resistance. We can treat urothelial tumors, stenosis, we can coagulate, and we can even treat prostate if we are using high-power system. The first report with holmium in urology was in 1992 by Johnson. So it's not a very new technology actually. This is the first report from Johnson, 1992. As you know, holmium is absorbed in water, in saline, but as you can see, this is not at the maximum peak of absorption in water. The wavelength is 2,100 nanometers. Means that you cannot see the light. You can only see from the violet until the red. So it means from 400 to 700 nanometers. So holmium actually emits in the infrared spectrum, so it's not visible. Let's come back now on the anatomy of an Holmium-YAG laser. What do we need to produce an Holmium-YAG laser? First, you need a cavity. It's an opaque cavity with two mirrors at each end. Inside the cavity, you put a flash lamp. Usually it's a xenon or krypton light, and this is this light who will activate the laser. Into the box, into this cavity, you put a crystal. It's a very pure crystal made with yttrium, aluminum, and grenat. That's the name, the YAG. Into the YAG, into the crystal, you pollute the crystal with a rare element called holmium. So you put some holmium into the YAG crystal. And if you do this, you produce an Holmium-YAG laser. And then you will activate the flash lamp. So these physical properties are relatively complex, so I don't want to spend too much detail to explain how it works. Just remember that when you activate this flash lamp through the crystals, at the end of the box, you will produce a specific light in the infrared spectrum, 2100 nanometer. And then the box will close again, and then you restart to activate the crystal. At the end of the box, you connect a surgical laser fiber, as you know, a different size, from 200 to 800, 1000 microns. And in this fiber, you will produce the different pulses. At the tip of the fiber, that's what you produce when you activate the holmium laser. You produce pulses, because you know that Holmium-YAG is a pulsed laser. It's not continuous. You have pulses of infrared light. And this effect that you produce into the water or in saline, it means these bubbles. You see the bubbles, it increases and then it collapses. That's what we call the Moses effect. It's a physical effect, and it was described in 1989 by Isner. So again, it's something not really new. The Moses effect, what does it mean? It comes from Moses. You know what Moses did. He opened the sea, and then the people were able to go from one side to the other side. So that's why we call it the Moses. Why? Because when you produce this Moses effect, when you produce these bubbles, then the photons are able to go through the bubbles in contact with the stone. That's the mechanism to transmit the laser light from the fiber to the surface of the stone. You need this bubble of gas just for the propagation of the photons through the bubbles. And as you see, if we come back to the original paper in urology by Johnson in 1992, he already mentioned this mechanism, the Moses effect. Now we have also the Moses technology. And you know, the Moses technology is coming recently from luminous. So what is the difference between Moses effect and Moses technology? In fact, there is no difference. The Moses technology is a special Moses effect. You see on this video, the Moses technology, it also produces bubbles, but the shape of the bubble is different. And this is the Moses technology. Luminis was able to modify the production of these bubbles. And in the Moses effect, the classical effect, it's a round bubble, and you see this bubble increasing in size, and then it collapses. For the Moses technology, it's in fact two pulses, the first one to produce a very small bubbles, and the second one producing a different bubbles looking like a funnel. But at the end, Moses technology is a specific Moses effect. The question today is to know if we are more efficient using the regular Moses effect or if we are more efficient when we're using the Moses technology. Today, if we are looking at the publications, we cannot really say that Moses technology is more efficient. We have good preliminary results, but we need to confirm that. Again, regarding this pulsed laser, Holmium, we have to consider, as you know, the three parameters we already mentioned yesterday: the energy in joules, frequency in hertz, and the pulse duration. And as you know, if you combine differently the parameters, you produce different effects. And that's what we recommend. I already showed you this picture yesterday. And we need then to combine the different techniques. Now, and to conclude with Holmium, what is the difference between low and high power system? You know that if you are using a low power system, that's what we call 20 or 30 watts machines, the difference with the big machine, 100, 120 watts, this is just the number of cavities. The simple cavity that we described before, if you are using a high power system, it means that you have multiple cavities into the system. So what is the benefit to use high power system? Can we change something regarding the pulse duration, long and short? No. You do exactly the same with a low power or high power system regarding pulse duration. So can we change something regarding the energy level in joules? The answer is no. You produce the same energy level when we are using low or high power system. So what is the difference? The only difference when you are using a high power system is the frequency. Since you have 4 cavities in high power system, you can produce much more frequency, 4 times more. And that's why you are able to produce 80 Hertz with the high power system, while you produce 20 or 30 Hertz using low power system. And again, the question is, do we need actually this high frequency system compared to the low frequency? And it's still a question actually, and nobody knows actually if we really need high frequency to break stones. So now, what are the limitations of Holmium? Because we are using Holmium since a long time, so we know the limitation. And we have 2 problems. The first problem is that what we produce in terms of fragmentation, it's still too big. The fragments are still too big to evacuate spontaneously or maybe to be aspirated. And the second problem is that the technique is time consuming. As you know, we need to spend a long time to break big stones. And I think yesterday we have seen excellent example. Holmium is efficient, but it's relatively slow, and we still produce too big particles. So what do we need if we would like to improve actually this technique? We need a new system to produce thinner particles. Because if we produce very thin particles, we know that most of the particles will evacuate. You have seen this morning. At the end of the surgery, if you produce dust, really small particles, the dust evacuates. At the end of the surgery, the ureter is full of dust. But you never see the ureter full of fragments, small fragments. You need to produce these thin pieces. And of course, we need to go faster. To produce thin particles, we need also to consider the size of the fiber. And I think you can easily understand that if we are moving from the regular fiber to 70 micron, and let's take an example. Let's move to a very thin fiber, 150 microns. What would be the impact? If you move from 270 to 150, you decrease the diameter by 1.8. But if you consider the surface of the fiber, you are moving from the surface of 270 micron by 150, you divide the surface by 3.3. So in terms of impact over the surface of the stone, you have to multiplicate the impact by 3.3. But since the impact is much smaller, you will produce small particles. So we definitively, actually, we need smaller fiber if we would like to produce smaller pieces. Regarding, again, the size, as we said, if we decrease the size, and in this example, between 270 and 150 micron, the diameter by 1.8, the surface by 3.3. And again, this is just an example. We can also move maybe to thinner fiber, 150, 100, or maybe 50 microns. I just take an example. But now, if we consider the energy that we will distribute into the fiber, let's consider one joule. It's a specific setting, 1 joule. If I'm using actually 1 joule in my regular fiber, 273 micron, my energy density would be 17 joule per square millimeter. That's what we call the energy density. It means the distribution of the energy into the fiber. So now, if I'm using the same energy, 1 joule in a smaller fiber, 150, what is now the energy density? If you calculate 1 joule in a small fiber, 150, the energy density would be 56 joules per square millimeter, so much, much higher. So it means that you will concentrate a very high energy on a very small spot on the surface of the stone. And then you will produce probably a bigger fragment. You multiplicate the energy density by 3.3 just because you decrease the surface by 3.3. So the density increased by 3.3. So if I would like to keep exactly the same energy density to produce the same effect, what should I do? I should decrease my energy by at least 3.3 to keep the same energy density. On this example, if I'm using 1 joule with a regular fiber 270 microns, I must use 300 millijoules with my small fiber 150, and then I keep the same energy density. So what do we need? And this is the second point. We need a new system able to produce very low energy, at least by dividing the energy by 3.3. And now what is the last problem? How can I go faster? Of course, if I'm using a small fiber with lower energy, I will be efficient. But since the fiber is smaller, I will need much more impact, we said before. And again, if we compare 150 and 270, we will need 3.3 more contact with the surface of the stone. So if I want to compensate, if I want to go faster, and this is the last point, I need a new system able to produce very high frequency to compensate. Otherwise, it will take much more time. In this example again, I need to multiply by at least 3.3 just because of the difference regarding the surface. So if I consider something, I need a system able to produce at least 300, 400, maybe 500 Hertz. So we summarize: to go faster and to go thinner, we need a new system today, able to use small fiber, able to produce low energy, and able to produce high frequency. Is Holmium-YAG able to do this? Can we consider that Holmium-YAG is a solution? Probably not. We cannot use small fiber, we cannot produce very low energy, and we cannot today produce high frequency. So Holmium cannot actually give these possibilities. And now comes the Thulium Fiber laser. What is Thulium Fiber? You need to forget this cavity with the mirror that we described before with Holmium. Forget about the crystals and forget about Holmium. The Thulium fiber is a fiber, and this fiber is not the surgical fiber. This is the fiber who will produce the laser light. Again, this is not a cavity like Holmium, this is just a fiber, a very long one, 10 to 30 meters long. But it's a very thin fiber. And the center of the fiber is 10 microns. So it's really, really small. And the center of this fiber is completely transparent. And it's doped by thulium elements. So it means that you take this thulium element and you pollute the center of the fiber with the thulium. So now you have a long fiber with thulium element in the middle. That's what we call a thulium fiber laser. To activate this laser, we are not using a flash lamp like Holmium, the krypton light. We are using diode lasers. And it's possible to connect multiple diode lasers to activate this system. This is actually the thulium fiber element. At the end of this fiber, you still connect surgical laser fiber. And with this element, it's possible to connect very small fiber, up to 50 microns. You remember, for Holmium, the smallest one actually is 200. But with the thulium fiber, it will be possible to connect very small fiber, 50 microns. And now that's what you produce. Look at the effect into the saline. As you can see, it's still a Moses effect. But again, it's a completely different Moses effect. It's plenty of bubbles, as you can see. It's almost continuous. It's not continuous, it's still pulsed. But you see the speed, much, much faster than Holmium. If you look at the spectrum, thulium fiber is very close to Holmium. It's also in the infrared spectrum, so it's not visible. But now the spectrum is 1940 nanometers. So again, very close to Holmium. But if you look in terms of absorption in water, you see that thulium fiber is at the maximum peak of absorption for the water. It's 4 times more absorbed than Holmium. Just the comparison, Holmium versus thulium. 2 different technologies, 2 different effects, as you can see. And again, just to see the view, this is Holmium, and you see this bubble who expand and collapse regularly, and the thulium fiber. They are also producing bubbles who increase and collapse, but much more than Holmium-YAG. Thulium is pulsed like Holmium, so it means that we have to produce to fix the parameters in terms of energy, frequency, and pulse duration. It's like for Holmium. The only question is actually that we don't really know which parameter is the best. Even we have some ideas, and you have seen this morning, we gave some recommendations, but we have still to evaluate which parameter actually the best. If you compare the two technology, that's the table. You can see the pulse energy, the difference, the maximum peak power. It's a very important parameter, the peak power. And the peak power for the thulium is 500 watts. So it's completely efficient with 500. For holmium, it's from 2,000 to 10,000 watts. And as you know, this is regularly too much. The peak power is mainly responsible for the retropulsions. I'm used to say that we cannot compare the specification really regarding the thulium and the holmium. It's like if you would like to compare two sports cars. You would like to compare an Aston Martin V12 and with a Ferrari V8. It's two different engines, okay? Very difficult to compare in terms of technology. You can compare the outcomes in terms of speed, but you cannot really compare the engines. If you would like to compare, you should select a V8 Aston Martin with a V8 Ferrari, and now you can compare the technology. Thulium and holmium, it's something similar. It's two different technologies. You can compare the holmium from Luminis and the holmium from Dornier, but it's difficult to compare actually the thulium with holmium in terms of technology. So let's go for the outcomes. What can we do with thulium? We have seen a nice demo this morning. This endoscopic view that you can see is coming from the lab. You see we are using the litho view to record all the videos on the left, and you see the external view. This is a stone, relatively soft. We are using 50 millijoules, as we did this morning, much more frequency because this is the lab, so we have no restriction. We use 1000 hertz, so it's 50 watts with a relatively short pulse duration, 0.2, and you see the effect. In few seconds, we completely dust a stone of 1 centimeter. 1 centimeter means 500 cubic millimeter. And you see the external view. It's really efficient and really fast, producing very small pieces. Coming from the lab, again, if we compare stone ablation, holmium versus thulium fiber is always superior to holmium. Even we change the parameters, since the first pulse, thulium is always superior to holmium. If we compare the dust productions in the same period of time with the same stones, we produce 3 times more dust than holmium, even when we are using the MOSIS technology. What do we call dust? As you know, there is no clear definition. What is your own definition of dust? Some people said less than 1 millimeter, it's okay. Less than ½ millimeter. In our lab, the definition is less than 250 microns, particles. So when we evaluate in this experiment the production of the dust, we fix the limit to the dust to 250 microns, 3 times more with the thulium. If we evaluate retropulsion, so it means the movement of the stone that you produce when you apply the laser on the surface, you can see that the thulium fiber produce 2 times less retropulsion compared to holmium. When we were using MOSIS technology, we're supposed to produce less retropulsion or long pulse. And it's interesting to see that MOSIS technology was completely similar to long pulse, meaning that maybe MOSIS is not so efficient, is not so beneficial regarding holmium, the regular holmium. And if we compare to the short pulse, thulium fiber was 4 times superior in terms of retropulsion. Safety distance regarding the endoscope, absolutely no problem. You can activate the laser very close to the tip of the scalp. You don't damage the scalp. It's very similar to holmium. Fiber breakage. We test it with small fiber, fully deflect in the lower pole. Even we were using 6 joules, it's a lot. We didn't break the fiber. It means that in the lower pole, it seems to be very safe to use thulium fiber in the lower pole compared to holmium. If we compare the temperature, if we increase the temperature into the kidney when we activate the laser, it's completely similar to what we do actually with holmium. Clinical evaluation, you have a nice experience in India, and we know that you actually confirm all these results coming from the lab, and they have a similar experience also in Russia. Dr. Martov from Moscow, he confirmed that it was completely feasible to use it during MINIPERC. He used thulium fiber. It was completely efficient. The American colleagues, Dr. Molina and colleagues, they also confirmed the superiority of thulium versus holmium. Also, to let you know that thulium fiber is really efficient to enucleate the prostate and to do something similar than HOLEP. It works very well. And Dr. Enikev from Moscow, he has a great experience with this system. Dr. Martov, again, also confirmed that it's possible to use thulium fiber to treat urothelial tumor for the conservative treatment of urothelial tumor. And this is the machine. Of course, in India, it's possible for you to buy the original one from IPG directly, but in the rest of the world, Olympus will be the distributor of this machine, and it's supposed to come relatively soon, probably by the end of the year. If you want to learn more, you can go for this publication. It's free access, so you can download this, where we summarize all this presentation. Thank you for your attention.
Thank you very much for that really excellent talk. So many new things are coming up, and you have really given a nice overview. If there are any 1 or 2 questions, I think there are a lot of enthusiasm about this thulium fiber technology, but we can take 1 or 2 questions, and Oliver can answer to them. Yes. Yeah, go ahead.
No, I think it's as you said, it's super promising. And you know, I was very happy to come for this meeting because it gives me the opportunity to discuss with colleagues who are using thulium fiber regularly now in the real life, I would say, because my experience is really coming from the lab. I did just few cases in Russia actually, and I must say that yes, it seems to be really promising, because it seems that you confirm what we have seen in the lab actually. So we will see, of course, maybe after 1 year, we will be able to confirm if it's completely superior to holmium, and if holmium will disappear. I don't think that holmium will disappear, you know, it will be another system. And then probably also regarding the price, you know, the people will also select the best equipment, probably.
Thank you. We were fortunate enough to use the thulium for 10 or 12 cases with a mix of RIRS, PCNL, I mean mini PCNL, and URS. And our experience was that because of the dust which is formed to a larger extent, also the bubbles or the air that is generated is a little more than holmium. So the end of it, we found that there was a more mucky kind of a bubble, especially when you use it in URS, and which would impair the vision. So what is your impression about this?
Yeah, as I said, my experience, my clinical experience is relatively limited actually. So that's why in terms of parameters, maybe we will have to adjust, probably. My feeling with thulium is also that probably we will use less the thulium for fragmentation, but much more for this dusting or micro dusting possibilities. And of course, we will have to adjust, as you said, the endoscopic view is something essential when we treat stones, but also with holmium. And that's why for holmium, for example, it's very difficult to keep a very high frequency parameters. Regularly, you have to stop because the vision is not clear. And again, with the thulium, we will have also to define what is the best parameter to be the most efficient regarding this visibility. But today, it's a bit difficult for me to give stricter recommendations.
Okay, thank you very much, and we conclude this session.